I need to go to it. Vice versa. I mean, cool. Perfect. Understood. Is that a common? Is that a common? Like, yeah, because you start talking and move. You move. Okay.
Okay, you should hear me. And Mike, you want to say something?
Four score and 7 years ago.
Turn that mic to your face, please.
Okay. That better?
No, don't touch it.
Let him.
Got it?
Got it. Oh, you're gonna need some. Oops. Oh my. It will get a little bit warm in here, so. Okay, one more time. Are you good, Mike?
I'm good.
Are you good, Lydia? Make sure you're up on that microphone real good.
Okay. Is that better?
Mike, you look good over there.
You're lying.
Am I?
Probably.
You ready?
So ready.
Here we go. Mike, you ready?
Got it.
And now for something special. The unit is self-contained with its own saddler, farrier, wheelwright and so on. It's a rigorous training dished out who know all there is to know about horses, and it brings results.
We take you behind the scenes now to show just some of the interesting aspects of this training.
Welcome back to Equine Dynamics with Mike Stein, the best podcast to create sounder horses from the ground up. Mike Stein is a registered journeyman farrier with an APF1 accreditation. On this week's show, we have special guest Lydia Cox. She is a doctor veterinarian of medicine, I'm going to fix this, and a certified veterinarian of Acupuncturist as well. And over to my far right side is Mike Stein. How are you?
Doing good. How are you?
And way over to my far right side is Lydia Cox. How are you?
Doing great. Thank you.
You look good. You sound good. How do you feel over there? Do you feel good?
Feel great. Yep.
Okay. So, Mike, I have a couple questions for you. It's an email that came in. And for those of you out there who would like to be part of the show, the way you do that is go to equinedynamics.com, email Mike and with your question, and we'll talk about it here on the air. And if we use it on the air, we'll send you out some stickers, some magnets, some things like that. Make sure you put a return address in there, and we'll send it out to you. So I had an email, Mike. You ready?
Right.
You ready for this? This is from, let's see, let me get the listener up here. This is from Beverly Hillcrest from Sandestin, Florida. You know where that's at?
It's in Florida.
It's up in the Panhandle. So
Okay.
here it is. I guess last week I said, I know you lead a horse from the right. Now, you agreed that, yes, if you're facing the horse is on the right. But usually it's referred to as the same direction as the horse is facing. A horse's left side is customary position to lead a horse. Now, tell me what she's talking about. This is Beverly Hillcrest from Sandestin, Florida.
Well, she is talking about you are on the left side of the horse.
Uh-huh.
And part of that goes back to cavalry and swords and mounting and everything else. And the on side, the side you get on.
So she said stand up.
The horse would be off your right shoulder, but you would be off the horse's left shoulder.
So she said stand about 12 inches away from the horse. Also, the left side of the horse refers to sometime it's called the near side.
Near side, yeah.
I don't know. I don't know anything about horses.
Near side and far side.
All right. Lydia, and with that being said, does that make sense to you as far as the near side? Have you ever heard that term used before?
I haven't heard the near side used before, but the left is usually what I hear referred to as we do all those things, right? Mount up, lead the horse, what have you, from that left side.
And what I meant to say was I stand on the left-hand side of the horse, the horse's left eye. The driver's side is the way I always call it. You got the driver's side and you got the passenger side.
But the horse was horse was off your right shoulder.
So I don't know if she's saying that I was standing on the right side of the horse or the horse was on my right side. I don't.
You were on the horse's left side.
I'm so confused.
You were on the horse's left side.
I wish someone could draw me a diagram. Now, another emailer out there, Wolf I forget his last name. I can't spell it right now. He sent this picture, and don't forget, for every podcast we do, we have a matching video as well, and you can see this picture in real time. Let me make sure I got the right camera up so we can all see it, and we can all be friends. So here we go. He sent this picture out and said, I found these in my yard. What kind of horseshoes are they, and how do they work?
They are not horseshoes.
What are they? They look like they got the nails and everything on it. They look like horseshoes.
Right. Back when I was doing competitive foraging, one of the things they popped up on us on the Born to Forge was they gave a half of a cow's hoof. And these are oxen shoes. Working oxen would wear 8 shoes, one for each. You know, they've got the split hoof, so you got 2 shoes per foot.
Okay.
And so at the Born to Forge, we had to, for extra points, you actually attached it to the cow's foot, but they would give you a foot to make it to fit.
So these are not horseshoes. They're made for
pulling oxen.
Okay.
You got your traction devices on it. So if they're pulling in the field in the mud and slipping, that gives them some bite to the ground.
Now, Lydia, welcome to the show.
Thank you.
And you know Mike. Give a little background of who you are, where you are, and how you came across Mike Stein.
Okay. Well, Mike and I go way back. I met him when I grew up in this area, around the Charlotte area, and then where we are now, Union County, riding horses. And I went to veterinary school, and Mike met me, I think, on my way that direction. So I actually apprenticed under him and rode around with him in the truck for half a year or so, and worked on, learned how to be a farrier apprentice on my way, getting accepted and then pursuing veterinary school.
Mike, was she a good student?
Best I ever had. I had one major problem, though. I couldn't find anything. She cleaned the truck up, but I couldn't find anything.
Yeah.
You mean she cleaned out like the passenger seat with all the garbage and all your receipts and stuff on the passenger seat? She got rid of all that?
I used to be able to tell where stuff was. It's like an archaeological dig. It depends on how long since you've seen it, on how many layers down it was.
Right. What date did I throw that down there? Oh, that was 2 weeks ago when I stopped by 7-Eleven and got myself a hot dog. There's the hot dog wrapper. It's right underneath that. Is that what it is?
Pretty much, yeah.
All right, guys, stick around. We got a big show to get into. We're going to talk to Lydia Cox about all the stuff that she knows and how it can help your horse as well. You're listening to Equine Dynamics with Mike Stein. Stick around. He'll be right back. There you go. First segment. I gotta get a paper towel. Excuse me for perspiring.
No worries.
You're the only one that ever stuck with me past a day or so.
Really?
Seriously?
I didn't know that.
I've had them come out and leave at lunchtime before.
Oh, yeah. I didn't do that. I was hung in a little longer.
When we come back. Ready?
Yep.
Ready?
Welcome back to Equine Dynamics with Mike Stein. He was the official farrier of the 2018 World Equestrian Games. And don't forget, for every podcast we do, we have a matching video. You can see us on the YouTube channel. Mike, your numbers are jumping left and right over on YouTube. You're getting
left and right.
Left and right.
Wow.
You're getting a whole bunch of followers over there, and I can see that 4-part series with Ray Morris is getting a lot more views, a lot more legs, a lot more traction, and so it's doing well. Your channel's doing very well. And you can see us here in the studio. You can see over my far right side, Mike waving to me waving to Mike. And we have a special guest here in the studio, Lydia Cox, Doctor Veterinary, am I saying that right, Lydia? Help me out here. Doctor of Veterinary Medicine, is that right?
You got it, Doctor of Veterinary Medicine.
And also a certified veterinarian acupuncturist as well.
Yep, CPA.
Now, how long did it take to get all these certifications and degrees and letters and alphabet soup that you got going on over there?
Great question. Many, many years. So DVM is veterinary school and undergraduate, and that took 8 years. And then the CVA program I completed more recently, and that was about 6 to 8 months.
And did you do it all here in the Charlotte area, or did you go out of state for that?
I went out of state for that. I went to the University of Kentucky for my undergrad work, so where Dr. Redden's clinic is, actually, Versailles, Lexington area. And then I went to Ross University for veterinary school. My final year was clinical at Auburn University in Alabama. And then I came back and graduated, and been all over the Southeast practicing, and most recently I've been in North Carolina.
So, when you're a little kid and people come up to you and say, little Timmy, what do you want to be when you're a little kid? And someone goes, little Timmy goes, I want to be a fireman, or I want to be a police officer or a school teacher or something like that. So when you were a little girl, was this the path that you were leading on? If not, what led you on this path?
That's a good question. I wouldn't say that I knew this from a young age, but it was one of those where I did grow up riding horses. We competed when I was younger and then all through college. And it was something that I didn't grow out of per se. And I became more interested, frankly, in the podiatry side. And the rest is history.
Now, have you grown up with horses and outside of schooling? I mean, did your parents have horses? Did your relatives, friends, neighbors have horses?
Actually, none of my family
Nobody
had horses. It was just my sister and I, and then I'm the one who I still have them, of course, today, and that's part of my life.
It's like that Midwestern kid says, I want to be a soccer player, and everyone in the Midwest goes, you want to do what? You want to be a soccer player. It has no meaning in the area that you're living in. Well, I'm sure you're an excellent doctor as well. So tell us a little bit as far as your traditional Chinese veterinary medicine. What does that mean when I say that?
Sure. So traditional Chinese veterinary medicine, or TCVM, is a little bit easier that rolls off the tongue as far as the acronym. That is a different way of approaching veterinary medicine. So I've practiced for many years what we would call Western medicine, what we're familiar with in this area in this country. And TCVM is an alternative, so Chinese veterinary medicine. And that's what I've most recently been studying and practicing here this year.
When you say that, I'm thinking of the little old lady, like from whatever movie. You can pick the title if you want. And she's chopping ginger, and she's putting in a mortar and pestle, and she's crunching it in, and then she's adding salt and like a bat wing or something like. Is it that kind of medicine that you're dealing with outside of, I guess, more natural, more than pharmaceutical companies, spitting out all these pills and tablets with all these different combinations on them?
Certainly. So holistic or natural are good terms to apply to that. And then there's 4 branches of TCVM. The first 2 are the ones that I utilize: acupuncture, so needles; herbal medicine that you're referring to. The other 2 are food therapy; and Tui Na, which is a massage technique.
So you do like the long needles in horses?
Correct. That's called dry needling.
Okay.
Acupuncture.
That was the question I had. Mike, have you ever had that happen to you before? Have you gone through that process?
I have had that done before.
Are you going to tell us where you had that done before? In the buttocks.
Let's see. They stuck a lot of needles in a lot of places.
Okay.
Felt like that little donkey.
But what was the purpose? Or were they sticking it in your shoulder, or were they doing it for your back? What area were you needing the attention?
Well, actually, what sent me there was some nerve damage in my right hand. And for whatever reason, whether it be that or anything else I was doing, it got better.
So, Lydia, the question I have, you brought up dry needling, and you brought up acupuncture as well. Mm-hmm. I had it done myself, Mike. I had it done in my buttocks. I had a pinched sciatic nerve on my right side, and I did lose feeling or pain in my my lower foot, my lower extremity down there. And I went down there, and they stuck all the needles and did all the stuff. They did the little electrodes, and it did the pulsing and everything like that. The question that I have is, they call it dry needling here. Is it because that over across seas they have a trademark on the word acupuncture or acupuncturist? I guess is my question, because once you cross over here in the Western world, they say acupuncture, but it's not what they consider true acupuncture. Like, you can only buy champagne from the Isles of Champagne over in Europe. It's not real champagne.
So acupuncture includes dry needling, but there are various other techniques, right?
So what's the main difference between dry needling and acupuncture?
Dry needling is a technique that falls within acupuncture.
Okay. So acupuncture is the big umbrella, and dry needling is underneath it.
You got it.
So what is dry needling missing that doesn't make it acupuncture?
Well, it is acupuncture, but it's just the needle. So it's a needle in tissue.
Okay. And so acupuncture would be?
So that's the overarching theme, right? So the other ones, for example, you mentioned electroacupuncture.
Yes.
That's where you hook up the electricity to it. Aqua would be, putting liquid in there. So I use personally, usually vitamin B12 is aqua. So all of those are falling under acupuncture.
And for the most part, horses, they behave while they're getting needles stuck in them? Do you have to sedate them? I know when you have to float teeth, of course. And this, believe me, I'm the simpleton as far as when it comes to horses. I know when you float teeth, you have to put the horse under some kind of relaxing, like a Xanax or some horse Xanax is all I can call it. With dry needling, do you have to do anything with them to let them accept this?
That's a good question. They actually really learn to appreciate it and actually like it. It's comfortable. They relax. You can see that when I'm working on them. And the nice thing is I generally don't need to do those things because the actual therapy can be relaxing. I wouldn't say sedating per se, but it's novel that we're not using medications or pharmaceuticals, like you said.
Now, Mike, you know, our mare, we've been having issues with our mare here.
Right.
And what is the actual, not problem, but what's the term that we're dealing with our mare? What is it?
You're a horse owner.
Yeah, I know that part. But she, go ahead.
Which one?
The mare, Dominique.
Right. Which problem?
Oh, I guess there's a laundry list of problems. I know. The reason why I say that is because, go ahead.
On my end, she's a low palmar angle in the front end, and we've been dealing with that. And then she's also got some problems up in the withers.
Now, I know that
spoke about.
Now, I know that we had a acupuncturist come out and put the needles in the horse. And and this is just my wife relaying the message back to me, is when the needle went into the horse, I forget what joint it was, whether it's the knee bone, hip bone, whatever, that a little bit of blood came out. Now, is that common for when you do a needle? If you hit like a pressure point, I guess I'm just going by what I see on the movies. The pressure point, a little bit of blood comes out. And when it did, it was almost like a dark cranberry red when it came out, rather than the normal blood, like if you were to scratch your hand on a bush or something.
Exactly. So it's not uncommon to see blood when you put the needle in that point. And actually in TCVM, the bleeding is encouraged. So that's a positive thing. And you'll see if you look closely, the color will change. You pointed out that dark color as it flows will turn into a more fresh, vibrant red, which is actually clearing the stagnation, which is what you want for TCVM.
So that's a good thing.
That is a good thing.
Okay, I just want to make sure my horse isn't, go anemic out there.
Nope.
All right, guys, stick around. When we come back, we're going to dive into the diagnostic scan of a horse and talk to more with Doctor of Veterinary Medicine, Lydia Cox. Stick around. You're listening to Equine Dynamics with Mike Stein. He'll be right back. You good? Mm-hmm. Cooling off in here?
Lydia.
What did I say?
Linda.
Oh,
it's all right. You're good.
No. I can fix that.
No. You're good. You're good.
Oh, sometimes my brain's
you're
loading the next sentence.
I was gonna say you're very high energy. I can hear you like on to the next thing.
Yeah. Sorry.
No
all right,
worries.
I'll fix that. Lydia.
You heard me stumble and say, I don't know what I said, but I kept rolling, but I stumbled on something and I was like,
I'll fix that. I can fix that in post.
I'm like, just keep going. Don't get stressed out about it. I like that. And I can bring it back to relationship between the team, which is my main goal.
That sounds like a lot of meat and potatoes there.
And yes.
Okay.
A lot of meat and potatoes.
That sounds perfect.
All right, here we go.
Right.
Welcome back to Equine Dynamics with Mike Stein. He was a 2017 American Eventing Championship farrier. And don't forget, for every podcast we do, we have a matching video. And you can see me waving to Mike, Mike waving to me. Make sure you go over there, like, subscribe. And over to my far right side, I mispronounced. Her name is actually Lydia Cox. And I stumbled right past it and said Linda by mistake. I apologize, Lydia. I apologize.
No worries.
Okay. Sometimes I get words and phrases cocked and loaded, and my mouth doesn't know what my brain is thinking. So I apologize on that. Lydia Cox, she is a doctor of veterinary medicine and also a certified veterinary acupuncturist. Now, Mike, in your field, in your line of work, you're a farrier. You do the biomechanics of horses.
Right.
How does working with a certified veterinarian of acupuncture or an acupuncturist help you in your battle of dealing with issues and problems that you have?
If we're working together on a horse, and it's always a team, there are things that I'm going to pick up because of couple of years of experience, 2 or 3, and dealing with education problems and whatever. And with sport horse, you have to pay attention to a lot of what's going on with the body. If she's going at the same thing, we're looking at the dynamics of the horse, we're going for the same thing, she's coming from a little bit different angle. She may pick up on something I haven't quite settled in on. And anytime we're working with feet, if we've got part of the body that's locked up, that's causing some odd compression problems that I'm always going to be chasing. If she can get something to release and we get rid of the compression problems, the whole system functions better. So that's the deal.
Now, Lydia, with you working with a veterinarian on Mike Stein's level, how does that help you in achieving the goals that you need to fix any horse problems or horse issues?
A farrier on my level.
Well, the thing with working with Mike is that we have open communication, and that to me seems simple, but is so the key to working together is that team approach. You guys have talked about it before, but it's involving everyone, right? The horse owner, of course, the trainer, the rider, as we are today, the farrier, the veterinarian. For me, I'm going to be the acupuncturist, but also the primary care veterinarian, right? We've got so many more, the saddle fitter, we've got chiropractic. My approach is acupuncture. And so working with him, that open communication is vital.
Yeah, very much so. If you're not communicating, it's not going to work out well.
So what's the best, let's see, how can I word this? What's the best situation that you can come into between the two of you as far as, do you technically need to be on site as if Mike's working on a horse saying, hey, how could you fix this? Do you ever work tandem, hand in hand, on site at the same time? I'm going to put the shoe on, let the horse walk for a little bit. He's got a little limp. She's got a little limp or whatever. And then you come in and say, okay, I know what to do. I can put a needle there. I can tweak this. I can do that.
That is not a bad idea at all. It can work well. Last week, I worked on a horse with a chiropractor, and they met me with the horse because we've been chasing some problems. Something I've come in on new second time I've seen the horse. But it's always good if we can get together. The thing is timing and coordinating, being there.
Certainly. Logistics can be a challenge. I'd say it's more common that we're talking on the phone, or usually we're talking when we're driving in between calls. So it's more common that we're going to not be working together on site, but it's certainly a treat and a pleasure to do that on site, but it's not as common that we're there on the same day in front of the horse.
Mike, go ahead.
I was going to say, the good thing with Lydia, when we work on a horse, is during the time we worked together, we worked on a few pretty ugly cases.
Right.
And then you went on and spent time up in Doc Redden's clinic, and we're thinking on a similar page. And we can connect, and we've got a good trust with each other. So, she's going to give me good, reliable information, and I know that. And I can work off of what she's given me.
Lydia, what's the biggest challenge that you come across when dealing with not necessarily a Mike Stein, but dealing with, getting a horse to where it needs to be?
Biggest challenge, well, like we talked about, is getting everyone on the team on the same page, of course, because we all want the horse is the bottom line, right? We want that to the performance and soundness and ultimately to be able to ride and be successful. So that can be a challenge, wrangling all, like we were talking about, the logistics and wrangling all of our communication. But sometimes, that may be the main challenge, is getting us all on the same page to help this horse. So we do great to observe and, like you said, talk with each other and trust each other in the relationship. But
so basically personnel, the communication in between, and make sure you have an open door policy, to lack of a better term. So Mike, you know what you have to do? You have to get on FaceTime. Do you know how to do FaceTime?
How do you do FaceTime?
You will have to learn quick if you want to succeed in this business, Mike. I'm nobody, but I'm just telling you.
Are you on FaceTime?
Well, no, I'm on. All you have to do is hit the camera on your phone and do FaceTime, right?
Okay.
Coming soon.
Coming soon.
Mike Stein on FaceTime.
Right. And, I know you're a one-man show out there, but if you had like an apprentice or something, you can have them set up a tripod like we have here in the studio, and then put your camera right on the horse, and you're upside down, so you might have to do the flip zoom.
Just turn the camera.
All right, guys, stick around. We got a lot more to get into. You're listening to Equine Dynamics with Mike Stein. He'll be right back. What do you want to dive into?
It's on you.
Okay, I can keep going. I can talk about diagnostic scan, acupuncture, or we can circle back. What you want, Mike?
Let's talk about diagnostics.
Okay,
scans.
I can do it.
This will be the second. Welcome back to Equine Dynamics with Mike Stein. He is now a licensed thoroughbred farrier through the Kentucky Horse Racing Commission. Did I say it right this time?
Yes.
Well, you say that. Am I saying it right? Do you know what it is? You just know that you're allowed to work on...
I'm allowed to work on horses sometimes.
Okay, well, that's good. And you've got the license to prove it. And over to my far hand side is Mike Stein. How are you?
Good. How are you?
Doing well. And we have a special guest here in the studio, and that's Lydia Cox, doctor of veterinarian of medicine, and also a certified veterinarian acupuncturist as well. How are you?
Doing great.
And don't forget, for every podcast we do, you can see us here waving to everybody. Everybody wave, and we're all friends here in the studio. Don't forget, if you want to be part of the show, the way you do that is go over to equinedynamics.com. At the top of the page says Contact Us. Fill out that little form. Any questions you want to ask, Michael, answer them here on the air, and if we read your question on the air, we'll send you out some magnets, some stickers, some buttons. Mike's got a whole bunch of brand new lapel buttons, as you can see him wearing one on the camera there. There you go, a little cute button there. I designed those myself, by the way. Thank you very much.
You did good.
I did all right. And we'll read your question here on the air. Now, we're going to talk about, with Lydia, about the diagnostic scan and what does that mean and how does it identify and isolate podiatry issues.
So that's how I approach the horse and what I do before I put needles in or practice acupuncture, so to speak. And it's called a body scan, or you may hear scanning the points. So when I see the horse in the barn or at their, their like comfort zone, so to speak, I would do a normal, what you consider a physical exam. Okay, so listen to the heart and lungs, check the eyes, check the ears, what we would consider normal or Western veterinary medicine. And then I'm going to scan the points. So I take a hub of a needle, I go across the acupuncture points and meridians over both sides of the horse's body. And then the horse will respond or react potentially in certain areas that may be sensitive.
And Mike?
Yes. No, as far as me, I watch a horse move out. I'm looking for odd movement patterns, waste of energy, trying to pay attention to how the body is functioning, body positioning, look at how the muscles are working. If something looks locked up, you can lay your hand on it and feel if it's locked up and start obtaining information that way.
Now, when you look at a horse, Mike, I know that sometimes when you're standing in the barn and I'm down there and you're talking to me and my wife's bringing up the horse, I know you're talking to me, but out the side of your eye, you're watching that horse come down the aisle.
Right.
I know you're not just sitting there because you love talking to me. I know that you're already doing the biomechanics of the horse as it's making its way towards you. Now, when you see something and you're like, oh, okay, I'm you're putting the pieces of the puzzle together in your mind, at what point do you go, that horse needs a chiropractor, or that horse needs someone like Lydia Cox over here? Do you do that in your mind? You're like,
mostly I focus on where I'm working, and part of the horse coming in is when it hits that concrete floor, listening to it, and if we've got the pelvis isn't moving right, if the pelvis is stuck, somebody can help me out with that. Whatever avenue we decide to go, if we've got, just trying to get if they can do anything on the top of the body to free things up, it makes my job easier on the ground, whether it be muscular, whether it be, chiropractics, whether it be what Lydia is doing with the acupuncture. And also, it's a check behind me or in front of me in case I'm missing something. Because, there's a lot coming at you in a hurry.
now,
I catch a lot, I think. But on the other end, if somebody can catch a little bit more to help us do a better job of putting the puzzle together, that's always an added plus.
Now, Lydia, what's the advantage of having acupuncture or doing the dry needling over than just your, like a chiropractor? Or is it one needs the other?
Good question. We often work together. You'll see many practitioners that practice both. But it helps to bring balance back and, help that horse move. And we're all working together to help them be more sound or move together. So often we work as well, hand in hand with the primary veterinarian, right? So your Western preventative type care and even sport horse veterinarians, the goal is to work together, not against, right? So to integrate this Chinese veterinary medicine with the Western practices as well. And then, of course, what Mike's doing on the feet.
Now, this is just me. Don't get me wrong or anything. Do you feel that people give you a pushback because they'd rather put a pill in a horse's mouth and say, this pill needs to fix this product, as to bringing someone in to do, the acupuncture type medicine? Do you get any pushback at all? Or do you feel that the horse community is more welcome to an acupuncturist as to, feeding horses pills to make them feel better? I'm just thinking about like a human, if I've got a back problem, doctor gives me, meloxicam, my back doesn't feel bad anymore. But then, I go to an acupuncture. It's a couple different sessions. It works. It worked for me. So, I mean, do you get a lot of pushback or any kind of like,
It depends on the client and the case, of course. Most of the time when I'm working on sport and performance horses, the goal is to relieve pain, muscle tension, what have you. So again, we're working together. So it's not that we're anti, like you said, pharmaceuticals or medications, but I'm working with those together. If they can help provide relief or get that horse that next level of performance, that's ideal. So, and the clients are generally seeking that, not necessarily giving pushback, but certainly there can be some stigma or, resistance around it because it's novel and new. But the nice thing, the clients that utilize it are looking for something that maybe either is a complement or they want to try something different that is not pharmaceuticals.
Well,
go ahead.
As far as being novel and new, I believe that the acupuncture goes back way before the pills.
That's exactly what I was going to say.
Exactly.
We've been out there smearing mud on our scrapes for many years before we started getting into the pharmaceutical end.
You got it. So acupuncture itself, of course, goes back thousands of years. And I say novel and new more to the performance sport horse industry, in that what you pointed out is that clients are more open to it.
On your upper end competitors, to keep them going, you see a lot more of this type of thing being done. Because
when you say this type of thing, you're talking about the acupuncture.
About the acupuncture,
okay.
Yes. Any body work, acupuncture, massage, because it takes a lot to keep these horses at their peak, and you are splitting hairs on who is the top one out there or not.
Absolutely. We can do that for show preparation. We can do it in the rehabilitation phase when they're coming down after the show. And sometimes it's what can give you that next level or that extra bump, when you're out competing.
Yeah, and definitely I wish on the upper end competitors, you have your show season, then we back off and we go into a little more of a rehab mode.
Right.
I wish more people would appreciate that and do that, because during that rehab point, if I've got a horse going competition, I need to make some changes. I've got to hold things together and not do huge changes anywhere. You're always changing a little bit. And then we get the letdown period. Then you can start making some changes and readjusting, because every time I make a change, the horse has to adjust how it works on a muscular level. And you have to recondition, rebuild. And you don't want to do that. Next week, I'm going into a big competition.
All right, guys, when we come back, we got one more little short segment, and we'll wrap up the show and let you get back to enjoying the rest of your day. You're listening to Equine Dynamics with Mike Stein. He'll be right back.
Right.
There he goes. Yep. That question, I'm sorry, that question wasn't off base, was it? As far as
No.
Okay. Because I don't know.
Yeah, I didn't mean to make it sound like it was new. It's more new that people are into it, because there are some people that are like anti. Frankly, the people who are bringing me out, they're already on board or they wouldn't have reached out.
Right.
But like if you talk about the general public, then it's a little voodoo and out there.
Well, the reason why I bring it up is because I've known my wife for over 15 years now.
Right.
And she's been around horses since she was a child. And until we came here,
Right.
I've never heard anyone, the acupuncturist is coming out. I'm like going, what?
For the horse?
I'm
What
sitting here
is
with
this?
a bad back. You got the
Exactly.
horse needles out.
Well, and we didn't have that option growing up. My mom and I were talking this morning, like we did everything we could. We tried, we had the farrier and the vet, and we did as much as we could do. We didn't have that option, when I was younger. So it technically is new more, obviously it's not new Chinese medicine.
So why don't they do it with like dogs and stuff? Do they do it with dogs?
They do. I actually practice. I know we're not talking about it today, but I do practice on dogs and cats on the side.
Do you really?
Yeah. So my CVA is mixed veterinary acupuncture, which I didn't mention, but my company or my business is Equine, but I still do, like on the side, I do dogs.
Do you wear a full body armor when you do cats?
Cats are really tricky. You have to have the right patient for that.
What about cattle or anything like that? Do you do?
I have not practiced. I could. I know the points. The nice thing is the points translate across species, but I haven't practiced on cattle.
That's interesting. Mm-hmm. Mike, did you know that?
No, I did not.
Maybe we should talk about it. All right. Maybe we will. I'll bring it up, and then we'll wrap up the show.
Okay.
Ready? Welcome back to Equine Dynamics with Mike Stein, the best podcast to create sounder horses from the ground up. Mike Stein is a registered journeyman farrier with an APF1 accreditation. And don't forget, for every podcast we do, we have a matching video. You can see me waving to Mike waving to me. And here in the studio, we have a Lydia Cox, a doctor of veterinary medicine, and a certified veterinarian acupuncturist as well. How are you?
Doing great, thanks.
Now, during the break, you were saying that you can do acupuncture on dogs and cats as well. Do you do like gerbils and hamster? How small of an animal can you actually do acupuncture on without injuring the animal?
So some practitioners certainly work on exotics, birds, small mammals. My practice is limited to, so I have mixed certification in the CVA or certified veterinary acupuncturist. So my business, Garland Cove Equine, I just focus on horses, right? The performance horses, the lameness, the soundness we talked about with Mike. But I do certainly practice on cats and dogs as well. So for me, it's just small companion animals, but there are practitioners who work on the exotics.
And Mike, what were you saying about the cat?
Well, I was wondering if she wore full body armor when she does cats.
All right, guys, what do we learn today? From Lydia Cox, everything that she knows about traditional veterinary medicine and how it takes advantage or helps our horses as well. Mike, working with a team, getting your team together. So what do we learn there?
Well, we have always struggled with getting a team together. The more connected the team is as far as working together, the better the outcome is going to be. You got anything to add to that?
Do you want to add to that?
Absolutely. It's like we talked about before. It's so important that we communicate and that the veterinarian, the farrier, the owner, the rider, we're all on the same page and can work together for the horse.
And being a farrier and also a veterinarian of medicine, I'm totally messed up. Words are hard sometimes.
Veterinarian.
Medicine, doing a diagnostic scan before even approaching the horse or approaching the animal to assess and identify isolated podiatry issues. Did I say it right?
Yes.
Okay, it just rumbled out of my mouth.
Well, she's going to be at an advantage on the podiatry issues over probably a good number of the acupuncturists because, she's spent time with me. She's spent plenty of time with Doc Redden. She's gone through all the way through the advanced podiatry training with Doc Redden. And that's going to set her ahead when it comes to dealing with that end of the horse.
And Linda, anything you want to, how can our listeners get a hold of you?
Lydia.
I'm sorry.
No worries.
Hold on. Let me know or let our listeners know, how can they find you? How can they get a hold of you on your social pages, your email address, all that stuff?
Sure. So my website is Garland Cove Equine. That's GARLAN. You can find me on social media, Instagram and Facebook. It's at garlandcoveequine.com. My email address is drcox, DRCOX, at garlandcoveequine.com.
We appreciate you coming in and spending some time with us here in the studio. On behalf of Mike Stein over there.
Thank you for hosting me.
Have a
And-
good one.
and
Good seeing you again, Lydia.
And Lydia Cox as well.
Hi, thank you.
My name is Travis Holmes saying see you next week.
All of the doggies are in the corral. All of your work is done.
No worries. That's how it's done.
Yep.
It's not that bad.
Any questions or anything?
I
thought you did very well.
Okay, I feel like I was a little, not stuttery, but just like not quite quick enough on the uptake, but
He'll shorten that up,
Yeah,
and
yeah.
I've gotten a lot better.
sure.
There's a
I see,
comfort
once
zone
like
with
you
it.
get into the swing of things, and I realized, but I was like, oh, it's a bit of a learning curve.